So what we tried to do here is, of course, you saw the whole stack of Eclipse Dataspace Working Group, various specification projects. And in the context of data spaces, we all know that a trust framework is needed for participants to be able to connect to each other and also have legal coverage or transactions legally covered in when they are performing data transactions. So here is an attempt to show how that could look like in practice a bit, combining some of the protocols along with the trust framework. Let's see how that happens quickly. This slide you probably already saw from Javier was presented. On the left side, you see all the various specification projects that are currently on the way. Some of them are quite advanced, some of them are still in progress. Basically, this is the stack layer of the Eclipse Dataspace Working Group with all the specifications. And this is sort of our view in terms of how additional things complement, which are not necessarily in the scope of Eclipse specification projects, but they are sort of in the center or in the core of things. Right. So at the very bottom, you see actual data being shared and data plane signaling, which is nicely acting up as bridge between data plane and control plane, which is from the data space protocol and decentralized claims protocol, which enables you to connect to exchange credentials. But the credentials, they can come from trust frameworks in those perspectives. But also other kinds of credentials that might be out there. And those trust framework, what kind of credentials, because they enable the connection from data space participants to these connector layer. So we are trying to connect business to technology components. And for that, what you need is sort of an participant credential, which is giving you the full compliancy credential on which framework they are compliant to, which data space they are fully compliant to, and data space rule books. Data space membership essentially extrapolates in terms of which aspects of data space that particular participant is compliant to. Whereas the framework compliance is reference to trust frameworks like iSHARE, GAIAX, and others. Which are also embedded within a data space rulebook typically, and also other kinds of claims. For example, if you are compliant to ISO certifications and other kinds of things. So it all nicely connects into a participant credential, which enables other participants to establish trust, authenticity, verification of various things in order to perform actual data transaction. Right, so that is the essence that we are trying to bring here together. And in addition, of course, the data rights policy profile project, which is also a specification project, which leads to a sort of what we call as data rights credential, is essentially a means to express that as a data rights holder, how do you express authorizations, consents, delegations, whatever you want to name it, to another party, so that another party can present that credential to the data provider or to whomever it is in the data space, so that it can access the data. And that basically, on a high level, is basically there is an issuer, which is the data rights holder, and there is a user who is the data user, is the subject, and it can give all the kinds of boundaries or policies or conditions of using the data, which data it is giving access to, under what conditions, and things like that. So that's a whole package of credential, as we call it, as data rights credential. Right. So that is what we are trying to demonstrate here. And I then came up with a use case. It's in the health domain to get the background. It's typically seen in healthcare that patient data is very sensitive, and for everything that you want to use patient data for, you need actually the consent of the patient, also from GDPR, but also in the health perspective. that to process that data and provide services or use it for whatever purpose it is. And the patient must be aware and be able to provide the right set of consent, including knowing that it knows for what usage you are going to use the data for. So in that perspective, we have this use case, and there are participants. So there is an Alpine Care Medical Center, which is basically an hospital, and it also acts as data provider in this context. Then there is Nordic Health App Services, which is basically an healthcare application which uses the data, patient data, to provide additional services to the patients. And in this context, it's acting as the data user or data consumer. Because patient need to give consent to its data for, for example, to share it with Nordic Health App Services, then a patient by itself cannot participate in a data space typically as a registrar, but it does participate through their own general practitioner in this particular data space instance. So, of course, there are different kinds of data spaces where it could be possible that patient directly participates. But in this specific scenario, we consider that it is participating through its general practitioner, where it is a registered patient. And that general practitioner provides them a service where they can manage all their consents over their own patient data to various hospitals, to various app services, or any other consumers that are there, right? Now let's quickly switch to the demo. And so for the context, in the background, the Eclipse Dataspace components are extended with iSHARE framework to work together. And let me stop sharing my screen 1 second and put up another screen. Do you guys see my screen? Yeah. So this is a demo environment which we have prepared. It's a view from Nordic Health App Services, which is the data consumer. This is not necessarily how it would be in production or in practice, but it could be. So this is one of the ways we envision that data spaces could look like or can be facilitated. And I'm logged in as that, and I see that, okay, I'm in a specific data space portal where I can explore the space to see all the participants. The participants that I just introduced are already listed here, as you can see, with their role tags. And of course, this as a provider, which is the hospital, then also has catalog. But I can also show you the details about that participant. For example, I can see that it, as a provider, it is agreeing to various data space agreements, which are coming from the rule book, and this is all connected live through the participant registry. So in this perspective, you can also see that me as a consumer, I am already also compliant to specific agreements. So this is also visible to other participants and things like that. Now let's look at the catalog that this data provider provides. So you can see various offerings with all the different sets of information that are there that you can see for all different data products. So these are, of course, all dummy data products with no real data behind it. But the key essence here is that this is the provider information, and there are the set of usage policies that are given out here. So for example, the first data product that you see, it requires that if you want to get access to this data product, then you must be a member of this data space. And in addition, you must provide a delegation evidence that you have authorization from data rights holder. So in this case, the consent of the patient in order to use or consume, request access to this data product. On the other hand, if you look at the second one, then you see the usage conditions are that you must be a member of this data space and that you are in a specific role and you have accepted specific terms of use within the data space. So it doesn't require additional consents, but it just gives you access if you are in the specific role within a data space. And you can then request access to this. And the third option that you see is a data product which doesn't have any usage policies. That means anybody can request access to this data product, right? Now let's have a look at the first one first, right? And here you can see further details about what a data product is. You know, its assets, it's who the data rights holder is, what kind of resource type it is, what specific identifier of that resource is, the usage policies, as we already saw that. And for making this demo, easy to demonstrate, what we have done is here on this part, we have actually created button initiated events for the data space protocol. Typically, it would be automated or event driven. But here we will simulate those events. For example, I, as a consumer, I like this data product. So I would initiate the next process, and then you can see that the contract is negotiated. This follows the data space protocol contract negotiation process. And that has been extended specifically to also have the evidence check, which is about the consent. So you also see that the consent was also in the policy. So it was also evaluated at that time. And then because every condition has been matched, so you can see that it checks all the policy conditions, and that the contract negotiation was finalized state with the agreement ID. Which means that now the consumer can request access to the data because there is a contract now. So when we can start the transfer process, and that the back you can see the status is changing, and that you see now the transfer status is in started, and on the right you see that download data button enables. So of course, you have to imagine all this in machine-to-machine perspective. So your systems would take care of taking the steps based on your events within your organizations. Of course, for demo purposes, what we are doing is manually introducing or simulating those events, basically. And when I click on data, then the data is basically downloaded. Sorry. Okay. Yeah, so this enables the download, and the data can be downloaded at the back. So here you see, I don't know if you can see that actually, but data was downloaded in the back. Right, now let's go back to the catalog. The same process that you can see in the another one, for example, in this case, you see that there is a difference, and there is only two-step process because here the policy doesn't require the patient consent, but it just requires that you are in the role of service consumer. So if I click on negotiate contract, then it gets negotiated, and then I can immediately start the transfer. And that would also make it possible to download the data. So if I click here again, then the data should be downloaded. And sorry, it was popping up with permissions. Yeah. So essentially, this is what you see in this perspective. Now, I can also show you that this conditions or these agreements that are of the consumer that is there. I will go to the backend system where it is coming from. I will simply change the status, which you can see that is getting reflected. Quickly do that. And if I refresh here, then you will see that the status have changed, which means now if I try to get access to this specific data product, and if I open a contract negotiation, it should not work ideally. See, because the agreement that was required is not there. So the moment you change, the participant status has changed or has been revoked, or anything happens which doesn't meet the conditions, then the contract negotiation process fails because it no longer meets the conditions for the policies of accessing the data product, right? So this shows how the combination works together. The trust framework, which is part of the data space in the process of onboarding and participant lifecycle management, and similarly for the data rights holder for the consent lifecycle or authorization lifecycle, the same effects are there. So when you have all things meeting the policy conditions, then you are able to request access to the data. And when any of those conditions are not met or has changed, then the effect is no longer you can access the data. So bringing all these hard work that we are doing in the Eclipse Dataspace Working Group all together under this demo. Quickly switch back to the presentation. I don't know if there are any questions.
I have one actually. So for the patient consent, I don't understand in a production environment, how would it work? I mean, like the provider is responsible for providing this patient consent, or it's like case by case for each patient has to accept to consent to use the data. How do you imagine it would work in a real life scenario?
Yeah, so that's so overall architecture. I think you are able to see my presentation, right?
Yes.
Yeah, so nice question. So indeed, the provider is just providing the data, but in the policy condition, there is a check that needs to check if the patient consent has been provided. And in terms of iSHARE context, what we have something called an authorization registry role. So like I was explaining, the patient is represented via the general practitioner of that patient. And that provides this kind of a service to the patient. So whenever the delegation check was done, actually the provider was actually checking at the authorization registry to check if the patient already recorded the consent or not. So there are two parts, and this one currently works through the API. And in the future version, what we are additionally implementing is that the patient can issue a verifiable credential about the consent to the in this case Nordic Health App Services. So then it can present that along with the as part of the contract negotiation process, that credential to the provider. So then it will be the patient directly gives consent to the consumer, and that consumer can directly provide to the provider. So provider can just validate. But in this case, it's through a service at the general practitioner, and that service API call is made in the back by the policy evaluation engine of the provider to check if there exists a consent from the patient to that specific consumer for that data.
Mhm.
I hope that answers your question.
Thank you.
Yeah. Yes, I see another hand, Pierre.
Yes, thank you very much for the demo, Rajesh. I do have a question. One time, at some point during the presentation, you mentioned here are the, I wasn't sure, user of the data space compliance attestation or something. And I was wondering if this is, can I extend a hand to try if we could express those compliance statements using the Eclipse CAP profile?
Yes, indeed. So I think if let me switch. Sorry. I think I think you are talking in this context, I believe. So the claims, framework compliance and other claims, this is where I see this fit very well. So depending on the data space context in the rule book, what types of claims they require from every participant, we can add them here specifically, and that can be issued through what we call as participant registry within a data space, because that's the expectation that every data space will have a participant registry which maintains who are the participants of that data space and issue them specific participant credentials.
Got
So
Thank you.
did from that perspective, yeah.
That would be, I think, a nice scenario in case there is another health data space they would like to express maybe similar attestation, then there is a semantic layer of interoperability.
Yeah, definitely.
Thank you.
Yes, happy to work together. Yeah, so this was sort of also the last slide. You can see the connectors are talking through DSP and DCP protocols, and the connection to participant registry and authorization registry in the current demo is based on API calls, but there is a new version coming which will also use DCP for machine-to-machine interactions with these protocols, but then the participant registry and authorization registry sort of acts as issuers, and they can directly issue credentials to participants and to the consumers accordingly, and then they would simply be able to reuse these protocols for exchanging the types of credentials that are there. That's all what I wanted to show, and happy to receive any further questions if there are any.